and welcome to Healthy India. I'm your host Lottie Alaric, and I'm here with you once again with a set of experts when we will be talking about pneumonia. That's right. I have with me three guests and I'm going to introduce them right now to all of you. Well, I'm very happy to welcome Director, Professor and Head of the Department of Pediatrics, Dr. Satindra Aneja, who's from Kalavati Saran Children's Hospital and Lady Hardinge Medical College. Welcome to the show, ma'am. Sitting next to her is Professor Dr. S.K. Kabra from the Department of Pediatrics at the All India Institute of Medical Sciences. I welcome you too. And to my left I have Dr. Suresh Gupta, Senior Consultant and in charge, Pediatric Emergency Medicine, Department of Pediatrics, Sir Gangaram Hospital. I welcome you too. Well friends, before we start asking any questions to our guests, let's all take a look at this report which will tell us as to what pneumonia is all about. Let's take a look. Pneumonia is the single largest cause of death in children worldwide. Every year, it kills an estimated 1.4 million children under the age of 5 years, accounting for 18% of all deaths of children under 5 years old worldwide. Many different bacteria, viruses and fungi cause pneumonia. One of the most common is Streptococcus pneumonia. Pneumonia is a form of acute respiratory infection that affects the lungs. The lungs are made up of small sacs called alveoli which fill with air when a healthy person breathes. When an individual has pneumonia, the alveoli are filled with pus and fluid, which makes breathing painful and limits oxygen intake. Other common causes include Haemophilus and Staphylococcus. More unusual bacteria are sometimes found, especially in people with underlying problems with their immune systems. A prompt diagnosis is vital and involves tests such as chest x-rays and examination of sputum in the laboratory to identify the microorganism causing the illness. Bacterial pneumonia can be treated with antibiotics and antifungal treatments can be given when a rarer fungal cause is suspected. Children can be protected from pneumonia with simple interventions and treated with low-cost, low-tech medication and care. Well, our doctors are going to simplify this further and make us understand as to what is pneumonia and how it is caused and what can be done in terms of treatment and prevention. So let me begin with you, Dr. Aneja. When we talk of pneumonia, would you like to tell us as to what is the kind of burden that you see of pneumonia in our country year to year?
Well, as you already said, it causes lots of deaths, and about one can say 4 lakh deaths per year are called under 5 due to pneumonia. And you look at the number of cases, it's very huge actually. Almost you can think that 1 in 3 children every year would have pneumonia, and if you translate into numbers, it's really huge burden of pneumonia.
Right.
And of these 1 in 3, some of them are, so 10% would be severe enough to require treatment in a hospital. So if you translate it into real population, it's quite a burden.
Number. That's right.
But what is thing is that it is most of the pneumonias are easily treated, and they can be treated right at the community level or at the in a small setup also, and that can prevent lots of deaths that are occurring right now.
Right. So, Dr. Kabra, when we say that 1 in 3, so for a doctor, is that an alarming number at all?
Yeah, it's obviously very alarming. But good thing is that we have a very good treatment for most of the pneumonia. Say out of 3, 1 child in a year will suffer from pneumonia, especially below 1 year of age, and majority of below 5 years of age. And out of these 10 children with pneumonia, 1 child may require hospitalization, but 9 may be treated on ambulatory basis. Main concern is that if they can come early, we may be able to treat majority of them on ambulatory basis, or you can say at home itself.
Okay, right. Now, when we talk of these deaths, so Dr. Gupta, I have my research which says that 99% of all childhood deaths from pneumonia occur in the developing countries. So what is the cause of that? Is it lack of awareness, or is it a hygiene standards, or what do you really attribute this to?
That's true. That so many deaths are occurring in India because of pneumonia. and it is multifactorial.
Okay,
we cannot
okay.
say, okay, this particular factor is responsible.
Right.
And the factors which we think are responsible or considered to be responsible are like indoor pollution. In India, particularly rural areas, for cooking they use burning of wood or coal,
That's
which
right.
creates indoor pollution. And same way outdoor pollution in the urban areas, which is controlled. Second, malnutrition is very common in India,
right.
and which reduces the immunity of the child, and child becomes prone to more infection, including pneumonia, and then overcrowding, poor socioeconomic status, and lack of complete immunization.
All right.
That is also one of the major factors which leads to pneumonia. So, in total, India contributes a large number of deaths due to pneumonia of the world.
That's
and
right.
many of them are preventable. Most of them are preventable.
True. So, Dr. Aneja, is there anything that you would like to add to this as to what just Dr. Gupta just said?
I think very important. He has actually said most of the factors, but breastfeeding in the first 6 months.
Okay.
That is very important because it prevents a lot of neonatal pneumonias. Because some amount of pneumonias also occur in the very young infants, which is the early infancy, and that can be really prevented by exclusive breastfeeding. And of course, he's talked about the risk factors which could lead, and again HIV, HIV is another factor which can predispose a child to pneumonia. Like malnutrition, HIV also reduces the immunity, and all the things which reduces immunity would add up to this. And hygiene, hand washing, for example. So
very simple
measures. So and all these are more common in our country because of various factors, because of poverty, because of the social factors. These are more common in our country. So that is adding up, and underlying population is also huge. So if you think about India as a country, if you look at the burden, the underlying population is huge, so obviously the contribution is going to be more. So even China would perhaps add up to many cases because of the population.
True. So, Dr. Kabra, which I think what I'm understanding is this, that a lot of it is preventable just by very simple measures that one's common sense is enough actually to prevent a disease like this. So, do you think that awareness campaigns need to be held whether through the media or other sources, so that at least a simple, something like pneumonia, at least let it not become a killer disease?
Yeah, there are two aspects. One is prevention of the development of pneumonia, that pneumonia doesn't occur in our kids, and that is all these things like exclusive breastfeeding in first 6 months, get all vaccinations which are available in our national program, give them after 6 months, give them food so that they do not become malnourished, and take care of the environment, that no one should smoke at home. They should, if they are using a biomass like cow dung or for cooking media, then they should keep their windows open in their houses so that it doesn't cause tissue smoking. So this is about prevention. But other thing is, the majority of the deaths are occurring either because of the people are not taking care of their children, identifying the disease and seeking care from a practitioner. So if we can create awareness among our masses that if a child is having some symptoms suggestive of pneumonia, they should immediately take the child to the healthcare facility. It may be government or it may be private, but they should seek immediate health care. And that would be that if a child is having some cough cold going on for 1 or 2 days, and then they are having a rapid respiration or difficulty in breathing. So one is rapid respiration, they are breathing more per minute. Along with that, if there is a chest indrawing, that is called that the junction between the chest and abdomen, if that is going in with each respiration, that suggests that child is having something like pneumonia or some similar illness. If that is there, if they go to a healthcare facility, they will get the treatment, and then that's it. They will recover. Majority will recover.
True. Now, Dr. Gupta, what would be some other symptoms which the parents or the other caregivers can, keep an eye open for, so that they know that if these are the symptoms that a child is showing up, maybe it's time for them to take this child to the nearest health facility, as he said.
As Dr. Kabra told, that if a small child or big child is breathing very fast, that is the most important symptom which the parents can make out. Okay, probably the child is developing pneumonia. In that case, they should not delay. The other things which will be there, like the child may refuse to feed, child may looking just very slow, sluggish, or sleeping more than usual. The child is looking very bluish kind of this thing because of lack of oxygen.
Right. Okay. And also, is there going to be fever also with this? Okay.
Fever is also there. Fever is an important symptom of pneumonia actually, but it may not be there in all the children actually.
That's right. Okay.
So these are the warning signs actually, in which case they should consult the healthcare provider, whether in the community or in the hospital, whoever is nearby, for a checkup. And for, but most of the time, particularly in rural areas, they may just go to the natural healer and delay the treatment, which increases the mortality.
That is true.
So that awareness has to be created actually.
Right. So Dr. Aneja, what is your view of this?
Well, I think most of the things they have already said, that the symptoms mostly they will start with cough. The important thing is coughs can be due to upper respiratory tract infections, which don't need much treatment, but many of the coughs and fever can be due to pneumonia. So it's a very critical for the parents when they come with cough and some infection, that we explain to them the danger signs, that if this is happening, the respiratory rate increases, or the child is not feeding, or there is what we tell them is pasli chal rahi hai, chest withdrawing, then you must immediately come back to the hospital. So because they will start with coughing, so at that point also people are made aware of, as you said, that there is a mass campaign and people know the signs of severe sickness and they report early to the hospitals, we can prevent lots of deaths.
True. Well, I think the point so far is this, that the symptoms are pretty visible, and if you keep an eye open for these kind of symptoms, then you can actually save these children from getting into any kind of complications that may arise out of this. So if ever your child is breathing very fast and there's fever, there's cough, and if you can't point your finger at what is happening, please take your child to the nearest health facility. For all you know, he may be suffering of pneumonia. But yes, that can be treated, provided you take the child to the doctor in time. Well, folks, we are slipping into a very short break right now. When we come back, we'll tell you as to how it is investigated and how do doctors confirm that yes, your child is suffering of pneumonia or not. All that after this short break, so don't go away. Welcome back. This is Healthy India, and today we are talking about pneumonia. Before we went into the break, all the three doctors told us as the kind of burden that India experiences, which is 1 in 3 children in India dies due to pneumonia. So which means it is largely also preventable, which also means that there's a lot of lack of awareness which goes into it. Otherwise, it could be prevented to a great extent. And now we know the symptoms, but now I'm going to ask Dr. Aneja that what is the kind of tests and the investigations that you would run on a child to establish whether he or she is suffering of pneumonia at all?
First, I'd like to correct, it is 1 in 3 child suffers
and not really dies.
Not really dies of pneumonia.
1 in 5 dies.
Yeah, and that 1 in 5 dies. Actually, we don't need many investigations to diagnose pneumonia. The diagnosis is made by clinical picture of a child who has cough and fever, and he has fast breathing, rapid breathing, and he might have chest indrawing. And so that is, if he has fast breathing and we diagnose clinically the child has pneumonia and nothing needs to be done. And the child can be treated, if there is no indication for hospitalization, can be just sent home with oral antibiotics.
Okay, so that's all
all is required. But if the child is having some chest indrawing and has signs that he requires hospitalization, then we admit these children, and even these children we don't need to do investigations always. Some of the children who have severe pneumonias, very severe pneumonias, there only we do recommend to doing an X-ray chest.
Okay.
And that's about it most of the time. Then some routine investigations we can do if it is required. Otherwise, for diagnosis is mainly clinical.
Right. So, Dr. Kabra, would you like to tell us as to what would be those routine tests really? Is it a blood test that you would ask for, or what are those tests?
The tests which can be done in children suffering from pneumonia are, one is X-ray film of the chest, blood test in which we see total differential counts, whether there is some infection, and then sometimes we do blood culture. generally we are not able to get sputum in children, so it is not of much use in pediatric patients. So majority of the patients do not require any investigation, and it has been seen that if you do investigation or if you do not do investigation, it doesn't alter the outcome. So better to identify clinically and treat them, and a small proportion who do not respond, we reserve these tests for them.
Right.
Another indication of doing, say, X-ray would be that if we are not able to differentiate what may be the cause, whether is it really pneumonia or something else, including, say, some foreign body aspiration, something has gone in the windpipe and that is causing tachypnea, rapid fast breathing. Another thing is, if we are suspecting that it may be because of some specific germ, bacteria, that is called staphylococcus. In that case, we may be doing an X-ray to see are there any evidence to support that it may be a staphylococcal pneumonia, because for that we may have to change the antibiotics.
Right.
But as I said, majority will not require any investigation. Only selected patients where we are in doubt, we are suspecting some specific bacterial infection, then only we go for any investigation, including X-ray or blood culture or blood test.
Right. I think that's really very well explained. And now, Dr. Gupta, for those patients whom you sent back home, that okay, it's fine for the parents to keep this child at home. So, is there any list of do's and don'ts that you give the parents, say in terms of how to, keep this child? Should he or she be covered properly, or what is the kind of food that should be given or should not be given? So, what are those directions to parents?
Basic is that we have to prevent the further episodes of pneumonia in that child.
Right.
A child who got one episode of pneumonia is more likely to have more episodes also, because already there are risk factor around that child or in that child causing pneumonia. And the same preventive things which I listed, like reducing the indoor pollution.
Okay, that's one.
Outdoor pollution, of course, we cannot control. I know, it's a depend on government policy. Not smoking in the house, giving a good nutrition to the child, keeping the immunization up to date, and breastfeeding, as Dr. Aneza told, is one of the most important thing by which we can prevent most of the infections, including pneumonia.
Right.
And in winter, of course, you have to cover the child properly.
True. Okay, so Dr. Aneza, what about children who are past their breastfeeding age? So what is the kind of nutrition, what are those food items that should be given to them? And if there's anything that you would say a complete no-no to, would you like to elaborate on that?
So generally nutrition, we have safe complementary feeds, what we say, which have to be adequate in their energy, they have to be energy rich, and they have to be safe. That means they shouldn't be contaminated with bacteria.
Right.
They should be freshly made, and they should also have some balanced kind of a diet so that they fulfill all the requirements of the child, and they should be suitable for the child's age.
True.
As you know, the child cannot take what the adult can take, so it has to be modified according to the age of the child. For example, a 6-month-old child just can take very mashed kind of things, pureed or mashed things.
Right.
Whereas a 9-month child can take a finger food kind of thing. And after that, the chewing and all is much more. So you have to modify the food which is available at home, which is nutritious, and it has to be done frequently, small portions. So that would improve the nutrition of the child.
Right. Now, Dr. Kabra, what about those children who may be, say, a little older than that but may suffer of pneumonia, but at the same time they are very fond of junk foods? So in such a scenario, what should parents do?
They should be giving nutritious food, whatever is available at home. They should not be stopping food due to illness. Occasionally the children may vomit because of the cough. So mother may feel that the child is vomiting, I should not give him food. That should be continued. But junk food anytime, whether it is with pneumonia or without pneumonia, they should not be given. They should be avoided in children.
Right. And can these children, suppose if the fever is not too much and the child wants to go out and play, or maybe just play in the home or something, so can that get dangerous for this child, or is it all right for parents to send him out also?
As far as children are concerned, what we follow the policy is let the child decide how much the child wants to play.
Okay.
It's only older people who say, okay, I'm sick, I can't move.
Right.
Okay, because psychologically they are more sick. But children psychologically don't feel that bad actually.
True.
If they are sick, they will be resting automatically. If they are not that sick, they will play automatically. Don't stop them. Let them do whatever they want to do. but take care that they do not injure themselves and get enough food.
Absolutely. And when it is rainy season, is it all the more important for parents or for elders to take care of children, and especially so that at least they don't fall sick with pneumonia?
Yeah, because in rainy season or even in winter, all kinds of droplet infections or airborne infection increases, and the reason because there is more moisture in the air,
right,
and the infection get transmitted from one person to other person much faster and more easily.
Okay.
So in that case, if somebody is having upper respiratory infection or pneumonia, it's better that he is little away from that child actually, so that he do not get the infection. And any child who is having some cough, cold or any other symptoms, it's better not to send the child to the school.
Right.
Okay. The purpose is so that other children do not get infected.
True.
Okay, from the community point of view. So taking these few precautions will really help.
True. Well, now this was about say the rainy season, but what about winters when children may suffer of pneumonia, because which means that all the more care probably needs to be taken for this child. If yes, then what would you advise the parents or the caregivers?
Just adequate clothing and giving healthy environment. That's all. Means you don't overclothe them also. Sometimes it's in our culture,
that's right,
generally there will not underclothing is generally not there. Actually it is sometimes overclothing. So adequate clothing. So in small babies like newborns, whatever is okay for us, you need additional for a newborn baby. So adequate clothing, I would say, not overclothing also, but giving normal environment otherwise. So besides that, as you said, you have to also teach the children, cough etiquette is to be respected by the whole community actually. You have to explain that if somebody is coughing, he should cough in a handkerchief or a tissue, facial tissue, and then dispose it off and wash their hands after that. That can prevent lots of transmission from one person to another. So that is another thing one can teach. But I would like to add to whatever we have said, that when we are discharging children from the hospitals, or if we are sending home a child with pneumonia, you educate them about the danger signs also. So if the child is having pneumonia and we are referring them back home, so we must tell them that when they should come back. If he gets sicker, he must come back immediately. So that is why it is important to keep on counseling the family members whenever we are treating any child with either upper respiratory tract infection, which doesn't require antibiotics, or with pneumonia and we are sending them home, so that they come back if they get sicker. So that is very important.
Right. So Dr. Fabra, are there any risks that this child who is suffering of pneumonia could be subjected to? Any complications that could arise thereof?
Yeah. As I said, majority will improve with simple treatment of oral antibiotics. Some of them may require hospitalization, but still there are some complications. One is that our drugs are not working and pneumonia may progress and it may go into respiratory failure in which the child is not able to breathe. So that is one of the important complications that causes mortality or death. Another thing is sometimes there is a sac in which lung is embedded, so that sac may get infected, and that is called empyema-thoracis. Pleura that gets infected, and that may become, there may be some fluid in that, and in our medical term that is called empyema-thoracis. Third one is if there is pneumonia which is uncontrolled and child is very small, having some low resistance power, in that case the same infection may go to the other part of the body. That may be say meningitis, sometimes even in the heart, sometimes even in the liver, here and there it may go. But these are very small proportion of patients which may have this problem.
True. So which means that if the caregivers or the parents are paying attention and taking real good care along with the doctor, then maybe these complications may not really come. But all that, let the doctor decide. Well folks, time for us to slip into yet another break, but do come back quickly, as then we will be talking about the treatment of pneumonia. So don't go too far, as we are coming back in just a moment. Welcome back. You're watching Healthy India, and today we are talking about pneumonia. Well, the doctors here have told us as to what are the causes of pneumonia, what is the kind of burden that India is suffering of, and what would be the symptoms so that you would know that this child is suffering of pneumonia or not. But now, as I promised that we will be talking about treatment, so I would want to know from you, Dr. Gupta, that when we talk of treatment, what is the first line of treatment that you would follow?
After identification, the first line of treatment, generally the healthcare worker decide is to give a shot of antibiotic.
Okay.
Shot means oral.
Right, right.
Most of the time we are able to give the oral antibiotics. And the two most commonly used antibiotics which we use in community actually, or we say health worker should use is cotrimazole and amoxicillin.
Okay.
But using proper doses and proper duration is important actually. We say around 5 to 7 days is sufficient in most of the cases.
Okay.
Provided it is given regularly. And if the child vomits, the dose should be repeated.
Right.
But in some of the cases where the child is not responding to this antibiotic, means even after giving 24 and 48 hours, child respiratory breathing problem is still continuing, or any other complication which we are observing, in that case we may have to modify the antibiotic. We may have to go to the higher antibiotics actually. Okay, that the doctor decide actually, depending on that particular situation.
True.
In addition to that, if the child is at home, okay, no oxygen is required because of mild pneumonia, that's why the child is being treated at home.
True.
But if the child is in the hospital, mostly it's a severe pneumonia, child may be needing oxygen.
Okay. Now, Dr. Meja, in our country we find the moment somebody suffers, say, of cough or little mild fever and all that, the parents very quickly start giving some kind of cough syrups to children. So in this case, are they advisable at all or not?
We strongly say that no cough syrups should be given to children. The reason for that is that the cough syrups, they will have some harmful ingredients which will suppress the cough but may make the child sleepy, and they might have more harmful effects. In fact, it is totally throughout the world it is recommended that no cough syrup should be given at all to children. And especially if they give higher doses, sometimes they, parents self-medicate.
Yes.
And what they do is they take adult cough syrup, they give it to a child, and it can noted to be have make the child just knocked it out. The children are knocked off, and they are they may not cough, but they are not well. They can become sicker, and it can be very dangerous. In fact, so we do not promote any cough syrup to children with pneumonia. It's not, it doesn't have any benefit and can be dangerous.
Right. So, well, that is the point that needs to be driven home, that no cough syrups for children, come what may. Please go to the doctor and just follow the doctor's advice to the T. Now, another thing which in our country, Dr. Kabra, is strangely that people indulge in is that the moment something like this happens in the chest or something, people will just start rubbing some kind of vapor of ointments and all that. So in this case again, children, are they advised, do you all advise them to use any of those vapor rubs at all?
They are not advisable as they do not change the outcome, and sometimes they may cause some problem in the skin, as well as if there is a strong smell, it may cause some more problem of pneumonia. Okay, so what to do? Because ultimately the child is coughing, he is suffering, so parents are worried about it. So the best thing is you can do some good home remedies. These are being used in our country for years together, for generations, and these are, you can use tulsi, you can use honey, you can use ginger, and ultimately your aim is that to soothe the throat by giving these homemade remedies. They will not cause any problem in form of a side effect which are associated with cough syrups, and they will help the child in early recovery. So we would suggest that we advise parents, mothers specifically, to prepare some drinks from these honey, ginger, tulsi, and give it to the child very frequently, and give lot of liquids so that the secretions are thin and the child is able to cough it out easily. So that would be the home remedy for cough, rather than Vicks Vaporub or some Vaporubs or other things, or say cough syrups which are causing suppression of the cough.
Okay. Now another thing that I'm sure you all also
what vaporizers often cause burn, and it is a very enough water.
So it doesn't have to be lukewarm water, or can it just be normal?
Just normal water they can take
okay.
actually.
Okay.
And because water will make all that sputum and bulk thin, so the child can cough out. And cough is not a bad thing in pneumonia. Cough is a good thing in pneumonia. Because by if you give the cough syrup,
healing.
Yeah.
Okay.
If you give the cough syrup, all that sputum which child was coughing will get into the time to recover.
Right. Now, another thing, Dr. Aneja, is the use of, like parents sometimes will say, even not milk, accumulate a lot. What is the doctor's order here?
There's no rationale behind it, but
Okay.
it is a very deeply ingrained in our culture.
Right.
Thing. If they don't give, I don't say that you must give. They can do without it for a day, but just milk is generally given to children. I mean, breastfeeding can be discontinued, but curds, I think in North India it is there. I don't know whether it is there in all parts. It's ingrained culturally, but there is no scientific rationale behind that.
Okay, so which means child can have curd.
Sure. We don't say that you can't take curds.
All right. Okay. Now I think, Dr. Kabra, you must tell us a little bit about those children who are, say, put on nebulizers sometimes, who may be suffering of some kind of breathing disorders. So are these children to be taken care of more seriously, and are these the children whom you all will hospitalize when they are suffering of pneumonia?
Say if you are seeing a child with fast breathing associated with cough, then one part is it may be pneumonia.
Okay.
And another similar illness is because of a wheezing, which may be after some viral infection, which may be because of some allergy. If there is a family history of adult member is suffering from asthma, then these children may be suffering from asthma or similar illness in which there is a wheezing. So nebulizers are used for children with wheezing, and those would be, if you ask them history, then it is that there is a repeated episodes of wheezing. With each change of season, the child may get some wheezing, and then you give the treatment, they recover. So these are different from pneumonia. These children do not require antimicrobials, antibiotics, but they may respond to bronchodilators. And in those situations where there is a problem of repeated wheezing, you can use nebulizer, or there are other methods of giving these medication at home. So doctors will decide whether he or she requires regular treatment with nebulizer or some other medication which can be given as a aerosol in form of giving it directly in the airways.
Okay.
And these are other group of patients. These are different from pneumonia.
All right. Now, Dr. Gupta, when we talk of vaccination, what is the kind of vaccination that is available for these children which can prevent pneumonia largely?
As such, all the vaccinations are important, not only for pneumonia, for other diseases.
True.
If the child doesn't catch other diseases, immunity will be maintained, he will get less of infection, including pneumonia. But some of the vaccines which are particularly important from pneumonia point of view, which we consider, is the measles vaccine.
Okay.
Okay. Because measles, when the children get the measles, they are more prone to pneumonia.
All right. Okay.
Okay. This is some particular thing actually. Okay. Then adequate nutrition, breastfeeding. Then two more vaccines which are important is Haemophilus influenza B vaccine, because that is a common cause of pneumonia in children. Now some other states have already introduced this vaccine in their schedule actually, but it has not been taken up by the whole country. And the third vaccine which is coming up is a pneumococcal vaccine. Some of the countries like US, UK, they are already using this vaccine. But as we are not really sure about what kind of impact this vaccine is going to have our country, so to recommend it on a mass scale may be difficult unless we really know the pattern of the disease in our country, what kind of germs are there. So once we know that, probably this vaccine may be also useful in the future,
okay,
but
so
not right now.
That's right. So maybe only time will tell whether those vaccines are going to be useful at all or not. Well, folks, it's time for us to slip into yet another break, but do come back quickly as there's still something more on the other side. Welcome back to Healthy India. Today we are talking about pneumonia. I have a set of experts here who are telling us as to what this disease is all about and how it can be taken care of. And now, Dr. Neja, I would want you to tell us a little bit about government policies that are there to control pneumonia at different stages.
Actually, government has been doing a lot for pneumonia. I think more than 20 years back we also had National Acute Respiratory Infection Control Program, which was primarily looking at pneumonia and how to improve the management. And now it is a part of another strategy that for child health, which is we call as integrated management of neonatal and childhood illness, in which ARI, acute respiratory infection, is integrally a component of that.
Okay.
And there are other things like immunization program, that is also part of the same thing. So it's an integral part of the child health strategy. And under IMNCI, the government has trained all the health workers, ASHA workers, Anganwadi workers, as well as the ANMs. They are trained to manage pneumonia, identify and manage pneumonia at community level. And if they find signs of sickness, they should refer it appropriately to the next level of care, maybe the community health center or a hospital. So that is an integral part of integrated management of neonatal childhood illness. And also the government is having a thrust on immunization. Again, we are having strengthening of measles immunization. We are having catch-up immunization for measles, where the immunization coverage is not up to 80%, and a second dose of measles is being currently given. So that will also further reduce the pneumonia deaths. And also government is also having a lot of things on nutrition. So we are doing, everything is a part of the child health strategy. So all these are actually looking after both prevention of pneumonia as well as protecting the child from pneumonia by improving nutrition, and also treatment of pneumonia. And besides that, with IMNCI, there is also what the government has also built the capacity of many professionals in working in small hospitals as community health centers, what we call facility-based care.
Okay.
So that was also the health workers were trained to. Professionals were trained how to manage pneumonia appropriately with a standardized treatment protocol, so that they would give oxygen to the children who are admitted appropriately, and find whether they need more care, then they should be referred appropriately. So government has done on all the fronts. It has its
right. But Dr. Kabra, what are the kind of results that you've seen of these programs? Do you think that they've actually succeeded in preventing a lot of pneumonia deaths at all, or not?
Yeah, definitely there is improvement, but still there is lot of scope to improve upon it, to decrease our under 5 mortality by controlling pneumonia, because it is contributing to around 20% of the mortality. So if we can take care of it, then we can reduce our under 5 mortality. That is important. And the results are there, but as I said, there is still more scope that we can improve upon it. The main thing is the mortality is happening because parents are not bringing their children to the qualified doctors. So if there is pneumonia, if they are suspecting it is pneumonia, they should bring the child to a healthcare facility or qualified practitioner and seek the appropriate advice. If it is being given, it will definitely reduce the mortality.
Right. Also, Dr. Gupta, do you think that maybe some parents are not bringing their children for the vaccination program also, and maybe that is also a reason why we are having pneumonia burden in our country?
That is true actually, because even if you see the measles vaccination, which is considered to be very important for prevention of pneumonia, the coverage is around 60% or 70%. So many children remain unimmunized,
right?
Because whatever operational reason or people's belief regarding vaccination. But the government is taking lots of steps to prevent pneumonia. Even zinc supplementation is being done by the government of India actually, because zinc has been seen to reduce infections including pneumonia.
Right. So which means that the government can do only so much, but it is the people who have to take benefit of all those schemes and whatever the government is offering. All right. So Dr. Neja, in the end, what would be your take-home message for the audience, for the viewers today?
For the public and parents, I would say they should provide children good nutrition and a healthy environment to protect the child from pneumonia, and to prevent pneumonia they should give immunizations as per the programs, and if they find any symptoms, they should immediately approach a health facility or a provider so that the child doesn't have diagnosed early and is treated early. So with these three things, we can actually reduce a lot of burden, the morbidity as well as mortality due to pneumonia.
That's right. So Dr. Kabra, is there anything that you would want to tell the public?
Yeah, as Madam has already said, exclusive breastfeeding for first 6 months, get appropriate immunization from our national programs, prevent say some pollution, say prevent smoking, passive smoking in children by the adult members should not smoke at home. They should, if they are using biomass, then there should be adequate ventilation in their home, and ultimately if even after this child develops pneumonia, seek advice as early as possible from a qualified practitioner.
That's right. So what will be your concluding remarks?
So to continue with the previous speakers, so public education, very important. Early detection, which all of us have already told.
Right.
Early use of antibiotics when needed, and getting to the healthcare facility.
True. All these things.
And nutrition.
Absolutely. Well, folks, at the end of it, I would like to show you what we've discussed so far in this little report. So do take a look at the recap. Of pneumonia include sudden onset of high fever, chills and sweating, rapid shallow breathing, shortness of breath, sharp stabbing chest pains, especially on coughing or deep breaths, cough producing unpleasant sputum which may be green, rusty or blood stained, confusion, muscle pain, headache, nausea and vomiting, and diarrhea. Stages of pneumonia are congestion, red hepatization, gray hepatization, and closure. The treatment includes use of antibiotics, oxygen for assisted breathing, intravenous drips, and in some cases, physiotherapy. And now I request you to write to us and tell us as to what did you learn in today's episode. If there's anything more you would like to see on Healthy India, please write to me on this address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com, and our toll-free number is 1800115314.
And now it's time for me to thank my guests for coming today and for talking about us, with me as well as with my viewers, about pneumonia. Thank you so much. Well, friends, I think the message is loud and clear that the burden of pneumonia is pretty heavy on our country, which means that 1 in 3 suffers of pneumonia and 1 in 5 dies of pneumonia. And the reasons could be many, from lack of awareness to not really seeking the health facilities. So please see to it that if your child is suffering of cough and rapid breathing along with fever, maybe he or she is suffering of pneumonia. So all that you need to do is take the child to the nearest tertiary center and let the doctor decide after some tests to know whether the child is suffering of pneumonia at all or not. And whatever the treatment, please follow it to the T, because if you don't, there could be a relapse of pneumonia too. So if you keep all these points in mind, along with good nutrition, and of course keep your homes very clean, there should be no pollution of any kind, be it smoke or be it biogas that you may be using, and your child could be free of pneumonia. Well, that's all I have for you this evening. Do join me next week for an equally engaging discussion. Till then, this is Lottie Alaric saying goodbye and take very good care of your health.